So I'm going to officially welcome everyone to the Englewood Town Hall event. We are happy to have everyone here, and happy thanks to Can TV for filming us today. So thank you, April, for talking about Cooking Matters. And I think Healthy Lifestyles is an example of what we're doing here, right? So with our school breakfast work, we're looking at how we can impact food access and food security at a policy level, sort of this overall umbrella level. But then we also have Cooking Matters, which is working individually with community members on how they can incorporate healthy, budget-friendly recipes into their meal plan, and then go to the grocery store and ask for these healthy, budget-friendly items to be available at the grocery store. So again, we're looking at how we have policy members who are going to talk to us today, and then we have programs. So I want to make sure I introduce, I know one other person's here is Melba Miles. If you want to just wave, she's in the back. So Melba and April are our community health advocates. We also do work here around reproductive justice, domestic violence, and a variety of other topics that are related to maternal and child health. And so if you're at all interested in learning more about EverThrive Illinois, please pick up our cards in the back. And again, I want to thank you all again for coming tonight. And I want to introduce our next organization who's co-hosting with us tonight. We have Stephen McCullough from the Greater Chicago Food Depository.
Good evening, everyone. Good evening. Hope all is well, and thank you for coming out tonight. And we are so proud to be a partner with EverThrive for tonight's town hall. So I want to talk quickly about a few things and talk about why we are here tonight. So Greater Chicago Food Depository is the food bank for Cook County. There are 7 other food banks in Illinois, and we serve all the neighborhoods and communities, municipalities in Cook County. Thank you. In Cook County, there are over 812,000 individuals that are food insecure. And what that means is individual, it could be a family, a child, older adult, does not know where their next meal is coming from, either because they can't afford it or it's a lack of availability. They're in a food desert. So in Englewood specifically, there are over 30,000 individuals that are food insecure today, okay? And we have a number of responses. In Englewood, we have over about 32 member agencies working in Englewood. And many of you are in the room. You represent churches, community-based organizations that are members of the Food Depository. And all that means is that you're able to access food that we aggregate from a number of different sources. We receive food donations, we receive government commodities, we buy a lot of food. And all of that food goes out to the community for free. Another thing we also do is around SNAP benefits, which is in Illinois is the link card. In Englewood, there is link cards represent $85 million. Annually, okay? And what that means is that's buying power. So you go to a retailer. In Englewood, there's a lack of retail. And so, but that money is real money that goes into individuals and families' pockets every month. And so we do applications and get individuals engaged in receiving SNAP benefits. Another resource that we have at the Food Depository and a lot of our work in partnership with EverThrive is around summer feeding, school breakfast, and at-risk after-school programs. So Janine, who just introduced herself earlier, is the chair of what we call a No Kid Hungry working group as a part of the Illinois Commission to End Hunger. And that the group is really focused on making sure that kids across the state of Illinois do not go hungry. As you know, free and reduced lunch is a big part of a child's daily diet. We want to promote school breakfast. We want to make sure that kids have every option available to them in terms of getting meals. And another big piece of that work that we're engaged in is around summer feeding. So across the state, We do a lot of work in making sure that communities have access, know where the summer feeding sites are, making sure that school districts that currently do not have breakfast are really pushing the envelope and making sure that breakfast in the classroom is available. Those programs are federally funded. That is money that we are constantly leaving on the table. In the summer, there's only 16% of kids actually take advantage of the program. So there's huge upside, not only in Englewood, but across the state. I mentioned there are 32 partners in Englewood, both West Englewood and Englewood proper, that we partner with. And so what that means is that, not only about food access, but our vision for Englewood is in to work with you on continuing to build capacity, making our existing partners stronger, making sure that new partners, we're always open and welcome to bringing on new people into the hunger fight. And to that end, our colleague, Cecilia Roman, is our service coordinator. So Cecilia, wave your hand. Is our coordinator for Englewood. And she's here. I'm here to be of support to all of you and to this effort. There's, food insecurity is something that should not happen in this country. We should not actually exist, but we do. And we are really the last line. Our pantries, each and every one of you are the last line of defense between, a child, an older adult, a family that will go to bed tonight not hungry. And so we're proud to be here, and thank you. Look forward to your conversation.
Are your appointments listed on your website? That's question number one.
Yes, our partners are listed. So if you go to our website, we have an agency locator. So if you type in, our partners are on our website. So if you go to, there's a section called agency locator. Type in the zip code, it'll list out all the partners. So we not only have pantries, but we have produce mobiles, we have school-based sites, the senior center that's here, we support. The last thing I'll mention, and something that we're really working hard on, is the intersection between health and food insecurity and partnering with EverThrive. So, the top 3 issues from a health perspective that if you talk to anyone in the health sphere is diet related. So it's obesity, hypertension, and diabetes. Okay, those represent the top 3 in terms of visits, health-related concerns. You go to any hospital, they'll tell you is diet-related. So I'm really, excited about the conversation because we can do a lot of good.
Thank you, Stephen. And before we move on, I want to just make 2 announcements. One, if everyone could silence their phones, maybe put them on vibrate. And if you have to take a call, please. Got in the hallway, and the restrooms, I believe, are right out in the back, little housekeeping. And then I also wanted to let you know that the note cards everyone has in their hands, those are for questions. So especially during the panel, please write down your questions, then you can hold your note card up, and we'll grab those from you, and we'll give them to our moderator to ask them. And on a personal note, I worked at the Greater Chicago Food Depository. The website is very easy to use if you're ever looking for an agency for yourself, for a family member, for a friend. Please check it out. There's always a pantry open everywhere in the city at all times. Probably not past midnight, but you can always find a pantry to get some food. So I want to now invite Jess Lynch up. She is a senior associate at the Illinois Public Health Institute.
Thank you very much, and I will just echo what Stephen said, that we're really happy to be part of this event, and thank you to EverThrive for putting this on tonight. So, as Jenny said, I work at the Illinois Public Health Institute, and I want to talk today about just a couple of the projects that we have going on at the Illinois Public Health Institute. So I'll talk a little bit about our Illinois Alliance to Prevent Obesity project, so good segue from what we were just talking about. And also a little bit about some of our broader healthy communities and health impact assessment work, and some potential opportunities hopefully to collaborate with all of you in the coming months. So for the Illinois Alliance to Prevent Obesity, the Illinois Public Health Institute convenes this statewide alliance. About 140 organizations statewide are part of these efforts, and the alliance has been around for about 5 years. The alliance is generally known by its acronym IAPO. So if I say IAPO, I'm talking about our obesity prevention work. So IAPO really focuses on sort of two approaches to the work. So one is working on a lot of statewide policy issues and also providing support for local organizations that are doing healthy eating and active living work statewide in different regions and localities. And the focus of our work is really around community environments and policy work. So we are not the folks to go to for some of the more sort of individual behavior-oriented type of work, but we really work a lot on community health and on policy related to obesity prevention. So just a couple examples of some of the work that we've been doing with IAPO over the last 5 years. We've been working with hospitals in different parts of the state to improve the types of beverages that are sold and provided in hospitals, to have healthier beverages in hospital environments. We've also been working with a couple of communities, including Springfield, on community gardening and urban agriculture planning, so places that maybe aren't as far along as some of the efforts here in Englewood and other parts of the city of Chicago, learning from what all of you have been doing and trying to share some of those experiences statewide with other communities that haven't had as much experience with some of the urban farming efforts. We also have been working a lot with different organizations that work on a lot of the issues that were already mentioned in terms of making sure that there is healthy food available in schools and access to healthy food and active living and active transportation across the state. So those are some of the initiatives that we have been involved in. Recently, over the last couple years, we've really become more involved in policy statewide. So this past year there were two PE bills, school PE bills for improving PE in schools that were passed at the state level that we were involved with. And another initiative that I was asked to talk a little bit about tonight is another policy initiative that we have been working on. So this is our Rethink Your Drink campaign, and also known as the HEAL Act. So the Rethink Your Drink campaign is really about thinking comprehensively about how to improve the beverages that we all have access to statewide, and thinking about how to really make sure that communities and decision makers are educated about the greatest single source of sugar in our diets, which are sugar-loaded beverages, which includes sodas, but also includes fruit drinks and sports drinks and other types of drinks with added sugar. So we are currently working with communities statewide on the Rethink Your Drink campaign, which is really about educating communities and also importantly decision makers about the health harms associated with sugar-sweetened beverages, and also working on the HEAL Act, which is the Healthy Eating and Active Living Act, which was introduced for the first time last year here in Illinois. And we really want to thank Senator Maddie Hunter, who's not here tonight, but part of this general area that was instrumental in leading and sponsoring the HEAL Act last year. So the HEAL Act would generate $600 million to invest back in the types of initiatives that we've been talking about in terms of school wellness, access to healthy foods, active transportation, community gardening, all of these types of initiatives that communities across the state want to invest in. And the way that that money is generated is through a penny per ounce tax on sugar-sweetened beverages across the state. And so we are really interested in getting more folks involved with this campaign. So if anyone in the room is interested in learning more about Rethink Your Drink and the HEAL Act, I'd be happy to chat with you about it after the event is over. And we have information on the back table with more information about that. So the last thing that I just wanted to briefly mention, as I said, beyond some of this obesity prevention work that we do at the Illinois Public Health Institute, we also have a great interest in working more broadly on making sure that people in sort of the public health advocacy sphere are really partnering with community development and planning and other types of institutions in the community to start to really bring health to the table and thinking about issues related to employment, living wages, housing, education, all the things that are so critical for our health ultimately. And so one of the opportunities that we are hopeful, we're in the final processes of processing a grant so that we can partner with the Chicago Department of Public Health, the Chicago Department of Planning, and community organizations and residents here in Englewood to build on the efforts of the Green and Healthy Neighborhoods Plan that I'm sure a number of you were involved with over the last couple years, to really start to move that plan towards implementation and think about how to assess what the health benefits are that can come from implementing some of the, particularly the green space and urban agriculture and economic development aspects of that plan. What are some of the health benefits that can come from that, and working with all of you to really provide input into the process of how to implement that plan and move forward with some of the aspects of that. So hopefully within the next couple months, we'll be back in touch through EverThrive and other partners here in Englewood to really move forward with all of you and thinking about how to structure that project in partnership with the city. So thank you for letting us be here today, and I'm happy to chat with any of you after the program.
Great, thank you. And now I'd like to invite Sarah Hamden up. She is from Iman. I had it down and then she'll do it. Speaking acronyms, you forget what things actually mean. So this is Sarah. She is a part of the Healthy Corner Store campaign.
Thank you. Hi, everybody. My name is Sarah, and I'm with the Inner City Muslim Action Network, also known as EMAN. We're based in Chicago Lawn. We're a community-based organization that provides health, wellness, and healing in the inner city through advocacy, arts, and culture work, and operating our holistic health clinic that's right out of our office. So I'm here today to talk about our Corner Store campaign. So I'm going to go over three things. I'm going to give an overview of the campaign, talk about one of our summertime initiatives, Refresh the Hood, and then just lay out a couple ways that folks can get involved moving forward. So our Corner Store campaign is really our flagship program. So it's a community, grassroots-led, campaign that really tries to transform corner stores in predominantly Englewood and West Englewood. And what we're really trying to do is to introduce healthier food options in these stores, to really sort of transform the space in these stores. I mean, we all know, you walk into these stores, a lot of them have the same issues, right? You see a lot of issues with with leaky roofs, signage on the outside doesn't always look that good, flooding after rains. We see a lot of the same issues. How can we fix some of that? We also, want to connect our, better connect our store owners to, the local community so that our store owners are starting to think beyond just sort of making that immediate buck, but, how are they really investing in a real way in the community? And overall, we just really want to get folks thinking about how we can really reimagine spaces in the community, and specifically our corner stores. So how do we do all this? We concentrate on 4 areas. So we're trying to, 1, create an alternative business model. 2, provide education and engagement in the community. 3, work to affect policy, specifically when it comes to food access. And 4, heal overall racial tension. So going back to this alternative model piece, so, I mean, there's a couple leaders in the room that have been heavily involved with the campaign. So like Ms. Miles, April, Ms. Thompson, they've all, been working with Iman for a couple years at this point, going in into these stores, sitting down with store owners and thinking through, okay, what are some of the changes that you want to make to your store? Does that, do you want to, do you need new refrigerators so that you could better store produce? Do you, are you having issues with, with roofing, with leaky ceilings? What are the issues that that you want to improve, right, when it comes to your stores. How can you start bringing healthier options into your store, snacks, fruits, vegetables, but just overall healthier things so that folks coming in, customers coming in, their hands can start hovering over, the apple and, picking up the apple versus picking up, the hot chips, picking up the sodas. So what are sustainable ways, that store owners can really, can start thinking about that, can start bringing in some of the healthier stuff. And so, we have just this constant contact with store owners throughout Englewood and West Englewood, where we really, work with them to connect them with resources at the city level, at the state level, but just resources where they can do better. The education and engagement piece. So, we recognize that if we fill our corner stores with fruits and vegetables, are people going to buy them? Maybe, but also maybe not. So, in going hand in hand with putting healthier options on the shelves, we know that there's an education component to this as well. Folks have to, be thinking about the food that they're putting in their bodies. They have to be thinking about just sort of the importance of nutrition and overall wellness. And we do that through a variety of ways. For example, on October 15th at one of our corner stores at 63rd and Racine, the corner store A Lot to Save, we're going to be having a community conversation. We're going to be involving the store owners. There's going to be, several of our leaders and just several, community members where, we want to sit down and think through, what is it that you want to see at the store? What's important for you to be at this, for the store owner, Ibrahim, to start selling. But, what can we do to work together to really, transform the site of the store. The policy piece, so, working with partners like EverThrive, we want to really think about how we can affect food access policy, on a city and state level. And then there's our overall healing of racial tension. So we recognize that a lot of the stores in Englewood and West Englewood, and really all over the South Side, are owned by Arab Muslim immigrants from the Middle East, and so there is a lot of tension between store owners and predominantly African American customers. So how can we heal some of that? How can we have real conversations with customers, with store owners, about the situations that we're seeing in the community, about the need to make certain changes. So one of our annual initiatives through our corner store campaign is Refresh the Hood. This year, April was out there with us every Thursday afternoon from 3 to 5 at 63rd and Racine. During Refresh the Hood, we pass out free smoothies to the community, fresh fruit smoothies, and then inside the stores we have available for purchase at a discounted rate is fresh produce. So folks really get a chance to just kind of see, okay, what would it be like if my corner store carried good, fresh produce? And our store owners also get to see, hey, people are buying this, right? So then, it's just an example for our store owners to see if you put it on the shelves, people are going to buy it, right? So yeah, and then so just through our Refresh the Hood, which again we do annually for roughly 3 weeks, we just get it's just a really good opportunity for us to really be able to just connect with the community and get a sense for would you like to see this more long term, and these are ways that you can be involved. And speaking of involvement, there are a couple of ways that, I think everybody in the room can better get involved with our corner store campaign. So like I mentioned, we have the October 15th community conversation that'll be at A Lot to Save, the corner store that's at 63rd and Racine. It'll be from 4 to 5 p.m. Again, it'll be an opportunity to really sit face to face with one of our store owners and really discuss, peel apart the onion, right? Walk through some of the issues, that we are seeing, and what can we do about these, corner stores. The second is actually this Saturday, also at 63rd and Racine, right at the intersection. There's a vacant lot that's right next to the store. What we want to start doing is cleaning up that lot, right? We want to we want to almost give it more of a community feel, right? Get, if rather than it being, full of garbage, rather than it just being, a space that just sort of is empty and just collects garbage, how can we make it something more than that, right? So then how can we overall transform the space that is that store, and then slowly, one lot at a time, one store at a time, how can we slowly start transforming the community? So I'll be around if anybody wants to talk more, intimately about our corner store campaign. I think that would be great. But otherwise, thank you again to EverThrive for inviting us to be here tonight. We really appreciate it. Thank you.
Thank you. And again, if you have any questions, we'll have some time at the end to ask questions to the organizations that are here. Finally, we have one last speaker from EverThrive Illinois. We have Sheila, and she's going to talk about a very important topic as we enter into the fall.
Hey everyone. You all are looking so good this evening. Glad to see that you all came out. I am here to talk about flu. How many of us are going to get our flu vaccine this fall? Raise your hand. All right, so let's talk about it. The flu vaccine does not give you the flu, and I can testify to that. I know there's a lot of misconceptions that are out there. There's a lot of myths that are out there. A lot of people have said, oh, the flu shot gave me the flu. No, people do. When people don't cover their mouths, when they cough and sneeze and they just touch it with their hands instead of sneezing and coughing in their elbows, and they touching on everything. The portal waves are through your eyes, your nose, and your mouth. Cover your cough and sneeze. If you're not going to get your flu vaccine, make sure that you take the necessary precautions to not only protect yourself, but making sure that you protect others. We want to make sure that we are washing our hands with soap and water. Antibacterial solution is all right, but soap and water works best. But I do want to share that the flu vaccine is actually safe. It does not give you the flu. People do. I think flu gets such a bad rap because a lot of times when people get sick, what is the first thing they do? They try to go to CVS, Walmart, Walgreens, get the Robitussin, NyQuil, all that great stuff, and realize after a week, 2 weeks, that didn't work. And then as soon as that doesn't work, it's, oh, I got the flu. But sometimes it could be pneumonia. It could be a respiratory infection. It could be a really bad cold. It could be a sinus infection. And it may be something else other than flu, but you got to go to the doctor to make sure that you find out if it is the flu. Because if you do have the flu, then you need to get the necessary medication to cure that. And sometimes that over-the-counter stuff is not going to work. What we do want to know, I would say this. A lot of people are under the misconception that it does, but sometimes people who get the flu vaccine have cold-like symptoms. I am the one person who gets that. My whole family, we go and get our flu vaccine all the time, and we do it as a family affair because I need my young kids to see that mommy gets shots too, because I want to make sure that I'm healthy, and if I'm healthy, it helps them to be healthy. And so when my daughter and son sees that I'm getting my flu shot, then they're like, oh, mommy is getting it too, so it's all right. My husband, my kids, nothing happens to them when they get their flu vaccine. When I get mine, I get the sniffles, I have a little sore throat, I feel like I'm a little under the weather, maybe about 2-3 days, then it goes away. When that happens, that just lets your body know that your body is having a response, a positive response to that vaccine. Now, I've dealt with flu. Don't want to deal with flu no more. Don't even want to dance with flu. But the one thing is that through the Chicago Department of Public Health, they are doing these vaccination drives throughout the whole entire city. And so they're going to be at different places, like at the alderman office. They're going to be at the libraries. They're going to be at different locations, at different churches in different places. If you want to know what site that is near you that is going to have that vaccination drive that is sponsored through the Chicago Department of Public Health, you can call 311. Did you know that? 311? 311 is a beautiful thing. I have mommy brain real bad, so sometimes when I'm parked on that street and I have all these signs, I can't figure out if I should park there. You can call 311, save your life. But what else can save your life is if you call 311 and find out where's the nearest vaccination drive for flu. You can get it at no cost. I'm testifying. I've been sick with flu. Don't want to deal with flu again. So I am quick to get my vaccine, and you're absolutely fine. The Chicago Department of Public Health, if you want to go to their website, they will have it listed at the City of Chicago/health, or you can call 311 and get more information to find out where they would do it at the nearest site near you. Now, the flu vaccine does not give you the flu, but people do. So we want to make sure that we protect ourselves. If you do not choose to get vaccinated, make sure that you just take the necessary costs to make sure that everyone is protected, even yourself. You wash your hands, you block your sneeze, your cough. But if you do get sick, please stay at home. Don't come on out. Don't get other people sick. If I don't see you at Walgreens getting orange juice and some medication, you should stay home. The flu vaccine does not what? Give you the flu. People do. All right, that's my time. Thank you all.
Good evening, everyone. I'm Natalie Moore, a reporter for WBEZ, and this topic is very dear to me. I cover a lot around food deserts, food access, and Englewood is really at ground zero for being innovative and also having some of the most dire need in this area. Urban ag has been thriving here. Farmers markets. There are a lot of community organizations doing great work, and I'm sure many of you are in the audience, so I'm looking forward to a great discussion. I'll introduce our panel. I'll start off by asking some questions, but I'm sure you all have some burning questions you want to ask, right? Or not? Okay. So I just want to make sure that I leave enough time and that we wrap up around 7:55. So next to me is Alderman Rod Sawyer of the 6th Ward, State Senator Jacqueline Collins of the 16th District, Alderwoman Latasha Thomas of the 17th Ward, and at the end we have Dr. Suzette McKinney, who's Deputy Commissioner of the Chicago Department of Public Health. Alderman Sawyer, since you're sitting right next to me, I'll start with you. So Englewood is part of your ward, even though people probably associate you more with Chatham, Park Manor areas. But tell me what is going on in your part of Englewood and any work that you've been doing around food access.
Thank you, Natalie. I'm very excited and sometimes troubled about what goes on in the entire ward, and that includes Englewood. Englewood, though, is at the forefront of food manufacturing. There are gardens all over the place. A lot of people understand the importance of providing fresh, healthy food and the business side of it, because that's what I always try to focus on, because there's a healthy component, which is great, but we also have to make sure that it's a commercial component, because we don't want Englewood to be an entirety of gardens making no money, and then Englewood will slide further down into economic chaos. So we want to make sure that we balance that properly. But I am excited about the work that's being done on the food front, but at the same time, I'm troubled because when I go to my stores, I either go to stores that have no healthy options, or when I talk to store owners that do provide healthy options, they get frustrated because they say nobody buys it. So I want to make sure that we stress that enough. It's one thing to make store owners or to convince store owners that it's the right thing to do to provide healthy options, more fruits and vegetables, healthier food, but we also have to educate the consumer in making sure that they purchase these items so that we can have our store owners be successful and provide healthy food at the same time.
You're absolutely right about the education component, but I've also seen store owners use that as a cop-out. And I've been covering the Iman Muslim-run corner store campaign ever since it started, like around 2009, the organizing. They started doing surveys in the stores, and one store said, oh, they're not going to buy it. It came back two years later, and those bananas and apples were all selling out. So I think there are a lot of misperceptions about African American buying power. Sure, some people have never been exposed to, fresh produce or know how to cook it, but there are others that you don't have to know how to cook a strawberry. You can just grab it. So it's been an interesting dynamic to see some of these store owners actually change, because they will just blame the consumer and say they're not going to buy it when they have no evidence.
That is correct. And like I said, it was the interesting dichotomy in it, but we have to keep pushing both store owners to provide it and consumers to purchase it. So I think that's an ongoing discussion we need to have on both ends.
And is Yale Elementary School in your ward?
Yes, it is.
Can you talk a little bit about the Eat to Live garden and what's going on? And that Yale Elementary is a closed school, but the garden has kept going.
I am excited about the Eat to Live garden. It is something that we've been working on since I've been in office. I'm happy that that the Real Men Charities and all the other groups that are involved in the Eat to Live garden is moving forward. It's producing. It's starting to expand in another area. Quite honestly, I was a little concerned when I first got in office. I went to Yale School and I visited the school, and I was concerned because even before we started talking about the school closures, I talked to some of my staff and told them that school's going to close just by walking into it and seeing what they were doing.
Why did you think that?
For one, the school they were redoing everything. It was strange to me. They were redoing everything, and as I was walking through the school, I was with the principal, and they informed me that the school was about 20% occupied. Lowe's had put a brand new park across the street. I don't know if you all remember that in 2011. And it was just odd to me for a school that was so underutilized, they were putting in so many resources into the school. And I had talked to Representative when they was first started the concept of the garden, when they were just doing a small lot next to Yale before they expanded to the other side. It just was strange to me. And we talked about it a year or two before the school closings were initiated. But now that that's passed, I am hopeful that we will have some reuse of Yale School to something productive, hopefully to connect it to the Eat to Live garden.
How is the garden doing, given that there are no students here? That was their main connection. Is this garden thriving?
It's still thriving. They had to shift focus. It's going to be more of a commercial endeavor. They were doing it for the children initially. That's why they had the small plot of land right next to the school. And it got bigger. You know, it got more expansive, and since we had the land right across the street from it, it's becoming hopefully a successful endeavor where I would hope that they turn a profit, make some money off of it.
Any other initiatives or gardens going on in your ward, or anything that you are championing?
As it relates to gardens, I want to make sure that we maintain that balance. I'm all for healthy options, again, like I said earlier, but I want to make sure that we're careful about that and that we continue to look for other economic opportunities, but the food option is important, and I want to make sure that we foster that. And we are looking at a couple other gardens. Nothing's set in stone yet, but we are looking at a few others.
But even outside of gardens, anything else that you think the community needs, or what other resources would you like to get for some of these stores, or just even for the residents, to make sure that they are eating better and getting rid of some of these preventable diseases?
Well, one, I'd like to think that people would come to events like this to get knowledge and get education about what we should be doing. There were so many good groups as I was sitting in the back listening to everyone make their presentations. We need to engage our constituents with this information. And once we do that, I think that people will engage in healthier options. They'll understand both the nutritional values and the economic values of eating well.
Senator Collins, I know that this is a topic that is important to you. I've interviewed you numerous times around food access issues. I want us to talk about the Illinois Fresh Fund. So if you could tell our audience what that is, what it was supposed to do, and where we are now in the state.
Thank you, Natalie, and I want to thank our EverThrive for inviting me out this evening. Many of the things that we do in Springfield you never would read in the mainstream media unless we commit something criminal. And so a lot of the work that we do, it doesn't get covered. So I really appreciate WBEZ coming out and inviting us to be a part of a panel. So I did sponsor maybe 6 years ago the Illinois Fresh Food Farm Jobs Act. And one of the reasons I wanted to put that legislation in place as an initiative to deal with what we call food deserts. At that time, there was a lot of work being done. The Tribune was doing a series on food deserts. And so I met with the governor and DCEO, the Department of Commerce and Economic Opportunity, to see what we could put in place to encourage entrepreneurs and supermarkets to relocate as an economic anchor into our communities. And what I did was I pulled a study dealing with Andersonville. And you know, if you go up to Andersonville, that's up on the north side, it shows where when communities invest in their communities and actually have businesses, small businesses, you know, small businesses are the real businesses that create jobs. So when you have small businesses, the dollar circulates 7 times or more within a community. And so what I was trying to do with this legislation was to ensure that we could encourage some of the stores, not only the chains that we know that vacated and deserted our community with the white flight, we wanted these chains, some of the chains to come back in, but we also wanted to create an atmosphere where maybe some local grocer, we have no, I don't think there's in existence any black grocer anymore. No. It used to be Chatham Foods. So we were trying to pull together some investors and other entrepreneurs who will be interested in coming back into the community and open a store. So I put $10 million out there to be leveraged. DCEO directed that money to the Illinois Facilities Fund as a fiscal agent. The argument I got, or the pushback I got from DCEO at the time was that, and even the governor's office at the time, was that we had no organization or agency with the fiscal capacity to leverage the 10 million, and because this organization had a track record of being effective and efficient with the money, and we really don't have any, I think there is now the Southside Credit Union, but at that time they were not in the position, at least the DCEO felt they were not in position or didn't have a track record in which they could really leverage the money, federally leverage the money with federal dollars coming in. So right now the money is with the Illinois Facilities Fund. They have not provided me with an update yet of where the stores are going to be located, but I did set as a mandate that they had to go into the communities that were considered food deserts. Because what happens is a lot of I met with IRMA, the Illinois Retail Merchants Association, and so the pushback I got from them was, where you're not going to get, or well, it might fall back onto what the discussion was previously, that we can't put a Whole Foods or a Treasure Island in your community because we don't think the people or the families will actually purchase or be willing or have the capacity to purchase on that level. So they told me that what we want to do, we want to work with Aldi's and Save-A-Lots. And so you see a lot of those popping up now. And so as of yet, I don't have an updated report. I placed a call today because I knew I was coming to the panel, participating in the panel, and so they're in the process of providing me with that update. But I think it goes back to that fallacy that's out there that if we put a Whole Foods or Treasure Island, because I get tired of going to Hyde Park, or now there's I think they're opening a Whole Foods, isn't it in Englewood? So my concern is, is Whole Foods coming in to benefit the community that is here now, or the community that's going to be coming in? So we have to be vigilant. But also I wanted to help, now I don't know if you know that most of the produce, I wanted to facilitate and help our downstate farmers as well, because poverty exists downstate. And you have these large conglomerates, these corporations taking over the farming. And so do you know that we export most of our produce instead of, and we're very fertile, in the Midwest it's very, very fertile for corn production, but we export it outside of the state. And so I wanted to try to encourage the farmers in the southern part of the state to provide produce to the urban core, so there could be a reciprocity as far as exchange. So it benefits the small farmer in the rural areas that are suffering from poverty, and also benefit our constituency, or my constituency, as well. So that's where we are right now.
I knew that Whole Foods would come up in a conversation like this, and unfortunately, we don't have the alderman from that ward to talk about it. But as a reporter, I can give you a couple of updates. There was a press conference last Friday at Miles Davis Academy, and the CEO of Whole Foods was in town, and they've been giving $20,000 to about 6 public schools in the area, and there's a garden at Miles Davis. But also of note is that this fall, there are 2 small business vendor fairs that will be at Kennedy King that Whole Foods is sponsoring. So any small business that is interested in having whatever they cook, whatever product they have, to be on the shelves at Whole Foods. So I know Rage, I'm sure there are people from Rage here. This is something that they're one of the organizations that is involved, among others, but that announcement was just made on Friday about the small vendor fair.
Let me just say, I think we deserve the quality that a Treasure Island or a Whole Foods would bring in, but I believe that I've heard someone make the statement that what Whole Foods represents is that they take your whole check. It's more about taking your whole check than anything else, but we deserve quality produce in our community.
So you also sponsored legislation in the spring that would put a 1% tax per ounce on sugar-sweetened beverages. How can that improve the health in our communities?
Let me just say my colleague is not here. That legislation was, the chief sponsor of that legislation was Senator Maddie Hunter. I was the hyphenated co-sponsor of it, and because I think that we know that in our community, many of our residents suffer from heart disease, hypertension, stroke, obesity, and diabetes. And we know that sugar, for example, we know that for a child, if they just take in 1 sugar-sweetened drink a day, they're 60% more likely to become obese. And for an adult, if you take in more than 2 sugar-sweetened drinks a day, you are 40% more likely to develop type 2 diabetes. And I think when we take that into consideration, we wanted to give a shout out to the manufacturers of these sweetened sugar drinks that if you're going to offer these drinks, we're going to tax you so that money could be utilized to either help to counteract the negative impact of providing these sugar drinks. And there's also a recent study, I don't know if you saw it, it's not only the sweet drinks now that are being pushed. We have these non-caloric drinks, these artificial sweeteners, and there's a recent report out today that even artificial sweeteners could cause spikes in blood glucose and sugar intolerance. And so when we have that dynamic in a community that's already lacking in resources to access to health care, it just builds up the possibility of communities that are not only dying, but also looking at our children, setting up a dynamic where they don't even have a chance. When you even go into the classroom, if a child does not receive the nutrition that they need, they cannot function in the classroom. And so they get labeled hypertensive or ADD or whatever. And so we have to, in some way, put a hold on these corporations that come in. And there's also a study that says that research has been done on how they market these sugar drinks. And it's been noted that they know that even when you give African Americans tea and it's sweetened, they like it. They sometimes even add more sugar to sweeten tea. And so what the study says is that a fast food company decides to offer a sweeter version of the tea at outlets that are in black areas and promote the regular tea in other areas. So that's another way that they victimize and take advantage of us not having the information that a public health individual can give, or if you go into get the information from if you have a personal physician, which most of us don't have, they go to the emergency room for medical care. And so these are the things that I felt while I really want to commend Senator Hunter for pushing this bill, and of course it didn't go anyplace because of the special interest and the money involved. So the bill is sitting in limbo right now.
Are there any other bills that you think could help address food insecurity, health, obesity in these communities? Is there anything that you're exploring, you and your colleagues?
You know, there was I just had a fight dealing with food stamps because, you know, on the federal level, they cut the food stamp allowance. And so I've been trying to push on the state level that in some way we could supplement the food stamps, and they even changed the schedule in which you can utilize your food stamps. And so I think and I think food stamps even restricts you as to what you can actually purchase, you know, and many of our families fall victim to the decrease in the budget allowance. And so that's an issue I'm looking at. How can we provide, instead of my residents and constituents going to the food depository, and we appreciate the food depository because I see they're sitting in the audience, but that should not be their role. It should not be the role of the church food pantries. Government has a place and a role and a responsibility to play to ensure that the policies ensure that we have food security.
Alderman Thomas, tell us what's going on in the 17th Ward as relates to food access, anything that you're working on or any initiatives that you're supporting.
Thank you, Natalie. I thought you were going to leave that very open. What's going on in the 17th Ward?
With food.
First of all, I want to thank you all for inviting me to this town hall, and especially on the topic. Englewood, in my ward, I have a number of communities, Englewood included. Englewood has strong organizations. So what we're starting to see is organizations kind of integrating food into their long-range community development efforts. But education is paramount to all of this. And we find that the youth or the children in the family can actually push the entire family to eating better if they know about what they're eating. And the younger we get them, the better. But some of the projects that I think that we're trying to start includes the quote-unquote youth market that offers, where the market offers and hires and trains young adults and young folks how to run urban farm food stands. Another example is actually occurred here with the Salvation Army and the Red Shield Center, where the Red Shield Center partnered with Food for Less, that's on 71st and Ashland. And so they had groups of families where they started with the children, and then the family came in, where they talked about healthy eating, experimented with different diets, found out what you really liked, you know. If it's fried, let's try it baked, those kind of things. And they had our certificates and other different incentives that came from Food for Less. And so Food for Less in the Red Shield Center helped the family shop for more nutritious foods. And it all started with the child. When my kids were young, my daughter, we called her Miss Biology. She told us what everything was that we were eating. So, you know, if we had that fried pork chop, she told us what that meant, what was in it and what it meant. What was in that hot dog and Polish sausage, she told us. And by the time she finished talking, you didn't want to eat it. But she was doing that in high school. And so, you know, that's an example of something that's happening or has happened in the ward. Oglesby School in my ward actually sits in Auburn Gresham, but has families from Englewood and Auburn Gresham. They have a garden, and they have children tending to the garden as young as second grade, first grade, all the way through 8th grade. And they take ownership in it. And when they take ownership in it, they go home and talk about what they grew, what they ate, what they should eat in the house. When the children are talking about it, the parents get involved. And so you have those kind of programs. We have an alternative school, so these are high school age to age 21. Community Youth Development Institute is one of the YCCS alternative schools. It's a charter school. And they have, I think they have about 12 campuses throughout they have a large garden. I don't know if you've been on 76 in Halsted and seen like chickens. Yeah. Okay, so that's them. They have a garden and a small farm, and they have contracts now. So it's an entrepreneurship endeavor. They have contracts with other restaurants in the community. They have a contract with Hyatt Hotel. And so they're growing, producing, eating healthy, and also using it as an entrepreneurial skill. And I think that's a way to get generations of folks to learn and eat better in our community and push everybody in the family to learn and eat better. Education is key to us changing the way we eat, to not bypassing the fresh fruit counter for the frozen produce or canned produce.
What kind of gaps are you seeing in education? What kind of models or programs would you like to see?
I like to see like what we had in Yale. I like to see what we have at Oglesby. I like to see that in more schools. But even in your biology class, I remember one time when CPS decided to have breakfast and lunch provided to every student, not just if you qualify, but it's provided to every student now. I charged a couple of high schools to have a chili contest, but part of it was to have in your biology and chemistry class to determine what the spices did to the chili, how it interacted. And so there's other ways that we could bring healthy living and healthy food into the classroom if it's not part of the program, it's part of chemistry, biology. It can, when I was in school, it was part of my PE class, PE program. I like to see more of that integrated into the curriculum.
I'm assuming that a lot of these schools that have gardens aren't trying to go commercial and sell to restaurants or make this a money-making endeavor necessarily. But what resources are needed to expand gardens into these schools? What does it take? When Oglesby did this, is it the will of the principal? Is it a community partner coming in? How do you get this
It's
started?
community partners, and like I said before, you have more organizations integrating food into their long-range community endeavors to develop the community. It's a community partner. You can't ask CPS to divert some of their funds to a garden, but you can have community input, community organizations that want to see some entrepreneurship or want to see just some nutritional, easy to grow teaching in a school, a neighborhood school. You need to have partnerships in those schools. You have businesses now that are starting to partner with schools because they're investing in their future workers. So the community should be investing in our future, and we can do that in different ways as we educate our students.
Dr. McKinney, obesity is a key issue for the department. Can you talk about how it fits into the overall scope of Healthy Chicago and then what is being done in Englewood?
Sure. So for those of you who are not aware, Healthy Chicago is really the city of Chicago's plan to help ensure that all of our city residents are healthy. And we know that obesity is one of the largest issues that are plaguing our communities. So we've talked a lot about children, so I want to focus on some of the initiatives that we've done to try to decrease obesity in children. So one of the things that we've done is we've worked at the city level to change some of the licensing standards for daycare providers. And what we've done in changing those licensing standards is improved the nutritional standards, and specifically what we have done is put regulations in place where daycare centers are not allowed to provide juice to children, whether that juice is artificially sweetened or naturally sweetened. And if juice is provided, it must be 100% juice, and it can only be provided to children 12 months and older, and it also is limited to 4 ounces per day. In addition to that, those standards include the provision of milk to children, whereby the daycare centers are restricted to providing only 1% milk to children unless there is a medical need for a child to have milk with a greater fat content. One of the other things that we've done with regards to licensing standards for daycare is required increased physical activity. So every child in daycare 12 months and over is required to be provided with a minimum of 60 minutes of physical play and activity outside on a daily basis. And then lastly, we've also limited the amount of screen time that daycare centers are allowed to provide to children. And by screen time, that includes television, movies, computer screens, and electronic video games. And those are some of the initiatives that we've done to really improve obesity in younger children. With older children,
As a follow-up on that, what has the response been from daycare providers, and how is something like that enforced or monitored?
well, in terms of the city level, we have put those standards in place, and they relate to the business licenses for those daycare centers. But one of the things that we are very, very excited about is that once we implemented these increased standards, the state of Illinois actually followed suit, and they have now implemented the same standards. They do the regulation for daycare providers. And so the state of Illinois has also implemented those same standards. And I would add that the state has also taken it a step further, where they now require daycare centers to make provisions for mothers who are breastfeeding infants but have children in those daycare facilities. And so what that portion of their standard entails is that they have rooms that they can provide for mothers to breastfeed, or rooms that mothers can use, refrigerators that mothers can have available so that breast milk is available to the infants that are in those facilities. And so it's one thing for us to impact the business licenses at the city level, but being able to implement these increased standards and get the state to come on board as well from a regulation perspective really helps with the enforcement.
And you're going to talk about older kids.
Yes, absolutely. So with older kids, and particularly moving into adolescence, we've partnered with CPS, Chicago Public Schools, to implement a number of different programs. And I brought an entire list because I wanted to make sure that I was able to capture everything. So one of the programs that we've implemented with CPS is what we call a revised wellness policy. And that policy centers around improving, making nutritional improvements in not only school meals, the breakfast and lunch meals that are provided at school, but also ensuring that there are healthier options in vending machines that are at schools. We're also working with a lot of schools across the city to extend or expand rather the farm to school program. So we've already talked a lot about the school gardens. So we're working with CPS to look at how we can expand the number of schools across the city that have school gardens. We also have created a wellness champions program where we have anywhere from parents to teachers to community partners really championing wellness and partnering together to increase programs and initiatives that foster health and well-being and decrease obesity rates among our school-aged children. And then lastly, these types of initiatives wouldn't be the same if some of them didn't also focus around physical education. So at elementary schools now across the city, it is required that children have 30 minutes of physical education, physical activity per day, so 150 minutes a week. And then also in high schools, daily physical education classes. And then lastly, I would add that the Chicago Department of Public Health, also working with CPS, we now have what we call a school health medical director, where there is a physician who works for CPS and she works for the Chicago Department of Public Health. And her role is to help facilitate all initiatives that ensure the health and well-being of our children in our schools here in the city.
Some school districts, not Chicago School District, but some other school districts outside of this, the District 299, which is the Chicago Public Schools, they're trying to push back, or they're not trying to, they are pushing back on First Lady Michelle Obama's initiative of healthy children, healthy foods. They're protesting some of the lunch suggestions that she's initiated. They're saying that the kids won't eat the food. I really think that we have to really stay aware of what's going on. I'm glad to say that CPS doesn't see the need to counter what the First Lady is trying to do. I think she's moving this country in the right direction because she really cares about the children and she is a mother. But just know, I think a lot of it is a political motives involved. But I know in Wisconsin, Indiana, Michigan, they're really pushing back on her program.
Whoever wants to answer this, is there a business development initiative, or will you support such an initiative, especially one that will launch a community drive for commercial access? That's commercial access for what?
For the community itself, or any community organization that was their drive or their initiative was to access the commercial properties and turn them into the enterprises that our community needs. And that's the question.
So I'll repeat that so our audience at home can understand. So any kind of business development initiative for kind of like a small business incubator, funding, vacant buildings that could be, I mean, this almost sounds like a school facilities question since Englewood has a number of empty buildings, but I won't, that's probably me projecting. So, okay. That's true. I was thinking of buildings that have infrastructure. Some of these vacant buildings around here, we don't know what they exactly look like inside. And since there is this RFP that's out for schools. But anyway, I think everyone kind of gets the gist of the question. We gotta get to, okay, thanks.
I'll start very quickly. And I know this for a fact that one of the gardens, not in my ward, but the garden on 59th and, is that 59th and Wood?
Growing Homes.
Growing Homes, exactly. They do have a commercial component to their garden. I know a lot of the top restaurants purchase their produce from, that's grown there. They have a job component there. You know, they're teaching people not only how to get involved in urban agriculture, they're paying them. And they're teaching them that this could be a profitable business. But I do want to make sure that we, again, like I stated earlier, make ourselves aware that we don't want to turn the entire area of Englewood into one big garden. You know, but we want to make sure that we provide an option, and I love the option with Growing Homes and all the other gardens that we have in the area that are producing commercially and teaching our youth how to get involved in agricultural, agribusiness. Agribusiness is a growing business. It's very profitable, and it's continuing to grow. And I want to make sure that we have people that are involved in that, but like I said, responsibly, and making sure that this is considered a business. You have, maintaining property to pay. You have to pay employees to work, fertilizer, things like that. This is a business, and I want people to understand that with growing homes and Eat to Live garden, these are gardens that their goal ultimately is to be profitable, to make money. So I encourage that both for the nutritional values and the economic values of it.
I would like to speak on the abandoned properties that we see all over the city. I chair Senate Financial Institutions, and so my battle has been to deal with these banks that, first of all, mortgage brokers that put us in a financial fiasco in reference to how our community was preyed on with predatory lending, and what I have tried to do is to, or at least what the Senate Black Caucus is working on. So this is, we're just initiating this. It's an ongoing battle because we have to deal with other my colleagues who don't understand the urgency or the impact of these abandoned buildings in a community. It sets up a dynamic for crime, and just the devalue of your property. If you have an abandoned house right next to you, that devalues your house, and if you want to refinance, you're going to have a lot of trouble in trying to get any kind of response from the banks. And so what we're trying to do is, first of all, we're going to work putting the vocational programs back into the schools, where if we go into CVS, we're putting it back into CVS, plumbing, engineering, electrical engineering, carpentry. We're trying to get the trades back into the schools, then having these students go out and rehab the abandoned properties, and then once they're able to sell the properties, that will continue funding the program, sort of be a cyclical sort of endeavor. So that's what we're trying to do right now. We're trying to utilize some of the monies that we had put aside for the urban weatherization monies. I don't know if you've heard of that program that we initiated maybe 2 years ago. There's money there, and so we're trying to come to an agreement with all the members where this would be a project that's ongoing and has a future. I mean, you can see it's a progressive, it's you're building on economic development, job creation, and job skills. And so that's what we're trying to do as far as dealing with the abandoned property. Now, some of the banks, because of all the negative exposure they receive because of the involvement in foreclosure, have been offering certain properties to certain agencies or churches in the various communities. I know this went on in North Lawndale, I believe, but the banks get a credit for that. But they were doing it as a write-off to show that, yes, they're admitting some culpability in the crime that was committed as far as the abandoned property. So they were giving these properties to certain agencies to rehab, and then they would write it off. So I don't know how successful that has been in North Lawndale.
I wanted to add a couple of things, Natalie, and I know that you have other questions there, but first, just to continue on the abandoned building part of that question, what most people have to understand is the building is abandoned, but it's still privately owned. It is not city-owned, but it's still privately owned. So that owner or estate, wherever they are, they still have rights. So when we talk about the foreclosed buildings, as the senator was talking about, when it's foreclosed, completely foreclosed, and title is shifted back over to the bank, that's when I'm expecting the bank to take ownership of that property. What they're doing, because they're not really doing anything to to the property. But what we're forcing them to do, whatever credit they're getting or not, is they're donating that building to a non-for-profit. Now we want that non-for-profit organization to do the community rehab, using community residents, using folks, helping them get jobs, using those that are in the vocational schools, that we get back the vocation into the schools, to bring that building back on the rolls in whatever way, so that it's actually paying taxes now. Someone is paying a real estate tax on it, and that's what we pay for everything in Chicago with, real estate tax. And so that's the whole process, but until that ownership changes, it's privately owned. So I can't say X, Y, and Z organization go into that property, rehab, and put it back on, because I don't have authority to say it. I will go to the bank and say, you've got to take ownership of this building and do something with it. As another example of most of us as elected officials are looking to bring commercial and residential development in our community. As an example of the commercial development that we did on 71st to 69th and Ashland, we actually had the developer have a program so that initially I had local business entrepreneurs also in the mall with help from the developer to get them started. Because if you have a commercial, retail, local entrepreneur, what they need is foot traffic. And so that mall, as you know, is anchored by Bank of America and Food for Less. There's a lot of foot traffic in that mall, which would help that entrepreneur get some of it to come their way. And the developer used their funding to help kickstart a entrepreneur. Not just anybody. You got to have a plan. You got to be ready to go. You got to be ready to go. Not just given. Any business that's given something is not going to make it very far. That's one thing. So we all have that kind of push in our community, and we want whoever. When we say we'll push, we have entrepreneurs that can do it. We want them to bring the heat. Bring the heat. As another example of a garden that's also making money, we have a garden on 76 and Racine, right behind Anchor House. They have that garden right behind Anchor House. They have a farmer's market on 76 and Racine. They're using that garden to sell the produce on 76 and Racine. They're imploring residents for the garden and also to sell. They're educating those and giving scholarships, and then they're also selling their produce. That's a way to make that whole circle in our community.
Quick question that can just be a yes for anyone. Someone asked, are there any herb gardens in Englewood so people are using more than salt? So all these gardens, are there any herbs?
Yes.
Okay. Public service announcement, someone wanted to say, since this deals with health. The Englewood 5K got approved for November 2nd. The person who wrote this, I can't give you the mic, but if you raise your hand, people can come talk to you afterwards. So Englewood 5K. Thank you. You're welcome. In Hyde Park, there was a cooperative ran store. Have black businessmen met around the table on this idea, but I have to give an asterisk that Hyde Park Co-op has been closed for years. If you have nothing to say, we can move on. Okay. No, it was a question. Have black businessmen met around the table on this idea?
Englewood has a business organization. I can't think of the right term of it now, but they have. No, no.
The Englewood Businessmen's Association.
I think it's,
with Callahan and.
yeah, but they have a business organization, and I would say, yes, they've come around trying to do collaborations together. I don't know that it's been about a supermarket or a grocery store.
How did Whole Foods replace Walmart? I would think that Walmart would be a better fit for the community. I guess just clarification on that too. Whole Foods did not replace Walmart because there was nothing on that location. So maybe the question is, why is Whole Foods coming instead of Walmart? Yeah.
Well, I don't know. This is just pure speculation because I have no idea whether Walmart was approached for that lot or not. I am interested to see what Whole Foods is going to offer when they set up in, I think, 2016, I believe. But I am concerned, like Senator Collins stated earlier, is this for the residents now or for the residents to be? And that's a legitimate question because I only can go to Whole Foods once a quarter. I mean, it's quite expensive. I mean, it's wonderful produce and things there that I like to buy on occasion, but it's not the store that I would go to on a weekly or every other week basis. Yes, you know, it's priced. When you walk out of there with 2 bags, it's $150. So
I guess I can probably talk. I mean, Whole Foods is becoming my sub beat now. I can offer a few things. Actually, Whole Foods and Walmart aren't that unsimilar. Hear me out. They are both kind of polarizing. Not everybody wants either one in their community. And when one is announced, you know, it gets reaction. If you say Jewel is coming, it's not going to be a press conference, but it's a press conference for either one of those. My, reporting experience has led me to believe that both of these chains have outgrown their traditional markets. There are only so many rural or suburban places you can go, and the same with Whole Foods. They are becoming much more mainstream. They're replacing the Dominick. So you have that. And they also are going into New Orleans, Newark, and Detroit. And the station sent me to Detroit last year to find out how, and that was the first grocery chain to come into the city. And Detroit and Englewood have a lot in common, at least as far as perception and being shorthand for Black urban underclass. So how did this work?
Now, I want to ask this, though. I don't know how this Whole Food is going to be, and they said they're going to have they're going to have more of their discounted food.
I was going to get to that.
But I want to ask you this. As an elected official, we shouldn't always be looking for the discount store to come into our community. We also want the market store in our community. And right now, Walmart, Food for Less, Save a Lot are the discount stores that are ready to come all the time. We want another Jewel. We want a Whole Food, or the Mariano's, which I think is a discount store, but it doesn't have that feel.
It's not a discount store. It's not a discount store.
I save money when I go there. I must shop well.
They have sales, but it is not a discount store. It's not a high-end store either. It's just, it's a grocery store. Yeah. But, as I was, let's see. So someone also said, it was in the media, Whole Foods said that they would meet the prices of the lowest price store, which is Food for Less. A survey was conducted. So I'm not sure what that is, but some of the other feedback has been these corner stores overcharge, and if you compare that to what Whole Foods might have, it could be a wash. When will the public see a more aggressive initiative by the Chicago Department of Health to partner with CPS on the building of better athletic facilities? And this will be the last question.
Well, I guess what I could say on that is, again, the Chicago Department of Public Health does partner with CPS with regards to ensuring the health and well-being of all CPS students. When it comes to building athletic facilities, that is where you get into many more organizations and leadership separate and aside from both CPS as well as the Chicago Department of Public Health. So I will apologize in advance that I cannot give a more thorough answer than that. However, I will mention, and it is not in the Englewood community, but we are beginning to see more community level athletic facilities and facilities that offer opportunities for physical activity being developed. But again, with regards to the Chicago Department of Public Health, that typically is not an area where we are involved in the decision-making process in terms of the construction of new physical athletic facilities.
You know, I think, no, it's not your department. It doesn't fall within your jurisdiction. All we need is another Jackie Robinson West team or like to win a championship. That park that they practiced in had no resources, had no batting cage. They had to go and prove to the city of Chicago that they were champions, but they should have had those resources in those communities to begin with. So now that they have gained recognition for the city is willing now to go and invest in our kids. Our kids need to be invested in because they are champions without winning a championship.
And that's the note we're ending on. I would like to thank EverThrive Illinois and like to thank all of our panelists, elected officials for being here this evening, and thanks to the audience. Do you like to close out or say anything final?
I want to thank you all as well. And I also just want to recognize our intern, Nicole, who did so much work on this. She's right over here. And also, please remember to complete your evaluations because we want to do this again, and we want to get a lot more topics. This was a really great event, and thank you to all the panelists. I really appreciated all that you shared tonight. I know the audience did as well. I know there were a few final questions, so we're closing the broadcast, but if people want to pass up their questions, we can figure out a way to get them answered for you. So thanks again to our partners that came tonight, and also thank you so much to the Salvation Army for hosting us. This was an amazing room, and it's a great place to have a meeting, so thank you again.